maybe once. Okay, well, that's good. Um, as far as stress, do you feel like you have a lot of stress in your life right now? I mean, you work, you're a student, that can be a lot to deal with.
No, not right now.
No, okay. Um, as far as when you do have stress, do you have a coping system, or what do you do so that,
I usually talk to my mom about stuff, and that usually just helps kind of get everything off my chest.
Okay. Have you ever had to see a counselor or like a psychiatrist to, help you with your stress or?
No.
No? Okay. Have you ever been exposed, or has anybody in your family ever been exposed to violence?
No.
No? Okay. Or abuse?
No.
No. Okay. At this point in your life, do you feel like you've accomplished any goals that you may have set for yourself?
I think in the past I would say no, but right now I'm getting myself back together.
Okay.
Everything's going great, so.
All right, you feel like you're on track for where you want to be right now?
Yeah.
Okay, good. I'm going to ask you a couple questions about your safety. Do you wear a seatbelt in your car?
Yes.
Okay. Do you ride a bike at all?
No.
No? Okay. Do you know if you have a fire alarm and a carbon monoxide detector in your house?
Yes.
Okay, good. Do you have any firearms in your house?
No.
No? Okay, good. Let's see. Are there any health hazards at your job that you're concerned about? And that can include any crime or violence, any pollution issues? Okay. How about in your home or in your community that you're aware of?
No.
No? Okay. And your water, what type of drinking water?
My mom usually gets the whole 24-pack of bottled water, so that's usually what we drink at home.
All right. Do you have any religious affiliations that you want us to make a note of?
No.
No? Okay. And any ethnic or any traditions, cultural beliefs that you have?
No.
No? Okay. And I'm going to do right now, I'm going to ask you a lot of questions. It's a review of systems, so I'm just going to kind of go through each system and ask you questions pertaining to each, and you can just tell me if you have any of these issues, okay? Or if you've experienced any of these issues.
Okay.
Any problems with fevers or chills, feelings of weakness, night sweats?
No.
Okay. Can you tell me your current weight?
I weigh about 110.
Okay, and do you remember the last time you weighed yourself?
2 weeks ago.
Okay, so it's pretty current.
Yeah.
Has it fluctuated much in the past?
No, it usually stays right about there.
You would say it's maybe your average?
Mm-hmm.
Okay. Are you comfortable with that weight?
Mm-hmm.
Okay, good. Any problems with the condition of your skin or your nails now or in the past? No? Okay. Do you have any problems with any moles?
No.
No? Do you use sunscreen on a daily basis?
I think my foundation has sunscreen in it.
Okay, good. How about the condition of your hair and your scalp? Any issues with that you've noticed?
No.
Is your hair, would you say it's dry or oily or normal?
I'd say it's about normal.
Okay. Do you have to wear do you wear any eyeglasses or contacts?
No.
No? Okay. Do you remember the last time you had your eyes checked?
I think it was about in high school.
In high school? Okay. And as far as you know, you had 20/20 vision?
Yeah.
Okay. Do you have any visual disturbances, any halos or anything that shouldn't be there?
No.
No? Okay. Any problems with hearing loss? Any ringing in your ears? Any problems with vertigo?
No.
Okay. No hearing aids, I'm assuming? Okay, good. Any history of like a chronic ear infections or ear infections at all?
No.
No? Okay. Let's see. Any sinus pain or history of sinus infections?
No.
No? Okay. Any history of bloody noses?
No.
No. How about runny noses? Any problems with that?
Mm-mm.
No? Okay, good. Just going to flip Do you remember the last date of your dental exam?
It was actually a couple months ago.
Okay, good. Any cavities that you know of?
No.
No? Okay, good. Do you have any missing teeth?
They took out all my wisdom teeth.
Okay,
So
alright.
4 of those.
Any prosthetic devices?
No.
Any dental problems that you have? Any issues?
Mm-mm.
No. Any problems with bleeding gums?
No.
No? Okay. And can you tell me how often you brush your teeth?
Twice.
Twice a day? Okay, good. And do you floss?
Yes.
Okay, good. Any lesions in your mouth?
No.
No. Any problems with sore throat or strep throat in the past?
No.
No, okay. Any problems swallowing?
No.
No. Have you ever had any problems with your voice being hoarse?
No.
Okay, very good. As far as your neck, have you ever noticed stiffness or problems with range of motion of your neck?
No.
No? Okay. Any swelling of your neck or tenderness that you've noticed up your lymph nodes?
No.
Okay. No lumps that you've noticed?
Mm-mm.
Okay. Any swelling of the glands underneath your armpit area?
No.
No? Okay. Have you ever noticed any lumps or any tenderness around your breasts?
No.
No? Okay. Any discharge ever from your nipples?
No.
No? Okay. Any problems as far as your respiratory? I'm going to ask any problems, but like with a chronic cough?
Mm-mm.
No. Any problems? Have you ever had problems coughing things up?
No.
Okay. Any shortness of breath or wheezing?
No.
Okay. Any history of asthma, pneumonia,
No.
Bronchitis or emphysema?
Mm-mm.
Okay, good. Any heart problems that you're aware of?
No.
Okay. Any high blood pressure?
No.
Okay. Any chest pain or heart murmurs?
Mm-mm.
Okay. Any rheumatic fever or exercise intolerance, which means that you might get short of breath with doing, a certain exercise activity?
No.
No. Okay. Let's see. Any palpitations or edema that you're aware of?
No.
Any claudication or to your legs at all?
No.
Okay. Have you ever had a cholesterol level drawn?
Mm-hmm.
Okay. Do you know if that was...
It came out good.
It was good? Okay,
Mhm.
good. Let's see. Any problems with abdominal pain?
No.
No. Any food intolerance that you know of? Okay.
Mm-mm.
Or that you've noticed? Any nausea or vomiting or problems with diarrhea?
No.
Okay. Or constipation also? That's a very common one.
No.
Do you normally, or how often would you say, how regularly are you with your bowels? Do you normally have one every day?
Yes.
Okay, good. Any history of, let's see, rectal bleeding?
No.
No. Any swellings of the glands in your groin at all?
No.
Okay. Any history of peptic ulcer disease or gallbladder disease?
No.
Any history of soiling yourself?
No.
No. Okay. Any pain with urination?
No.
Okay. Any flank pain or bloody urine that you've noticed?
No.
Okay. Any incontinence ever?
No.
Okay. Any urinary tract infections or sexually transmitted infections ever?
No.
Okay. Any vaginal discharge? Okay. Can you tell me your last menstrual period?
I believe it was the 5th of this month.
Okay. And was it a normal cycle for you?
Yeah.
Okay. Would you tell me a little bit about how long the cycle lasts and how light or heavier flow is?
It usually lasts about 5 days, and I have a heavy flow.
Okay. And I know you said that you take the ibuprofen for cramps.
Mm-hmm.
Are the cramps tolerable, or is it?
Yeah.
Okay. Do you have any premenstrual cycles? Any symptoms you get, or premenstrual symptoms? I meant to say. I'm sorry.
No.
No. Okay. And have you ever been pregnant before?
No.
No little ones to. Okay. Very good. Can you tell me the last date of your pap smear, or if you've ever had a pap smear?
I've had one a year ago.
A year ago? Okay. And was that all normal?
Mm-hmm.
Okay, very good. Can you tell me about, I'm going to ask a little bit, a few personal questions about your sexual history, and this is just to make sure that we're taking care of everything, not just, what we can see, but also, make sure that you're practicing safe practices. Are you sexually active currently?
No.
No? Okay. How many partners would you say you've had in the last year?
In the last year?
Mm-hmm.
No.
Or ever?
Oh, ever 3.
Okay. None in the last year?
No.
Okay. And were they male, female, or both?
Yeah.
Male? Okay. When you are sexually active, do you use contraception? Do you use condoms? Or
We use condoms.
okay. Are you on any birth control right now?
No.
Okay. Has sex been an enjoyable experience for you when you were sexually active? No problems or...
No.
Okay, no painful intercourse. Okay. Now we're going to go into something a little easier to talk about. I'm going to ask you a little bit about your musculoskeletal system. Do you have any problems moving your arms or your legs at all?
No.
Okay. Any numbness or tingling at all that you've ever noticed? Okay.
No.
Any joint pain or joint stiffness?
No.
Okay. Any limitation with moving anything? Any back problems?
No.
Okay. When you're up and walking around, is your gait normal?
Yes.
Okay. No history of head injuries?
No.
Okay. Any history of loss of consciousness for whatever reason?
No.
Any problems with coordination or dizziness when you're up and moving around?
No.
Okay. You said no to numbness and tingling. Any history of seizures?
No.
Okay. Any tremors or problems with headaches, like a chronic type thing with headaches?
No.
No? Okay. Any impaired cognitive functioning?
No.
Okay. Any memory impairment? Okay. Any irritability or mood swings?
No.
Okay. Any history that you know of being anemic?
No.
Okay. Any sickle cell trait in your family that you know of?
No.
Okay. Any bleeding tendencies?
No.
Okay. Have you ever had a blood transfusion before?
I have not.
Okay. Any thyroid problems?
No.
Okay. Any unusual sensitivity to hot or cold?
No.
Okay. Any problems with frequent urinations?
No.
No. How about like an increased appetite that's out of the norm for you?
No.
No. And excessive thirst. Any problems with that?
No.
Okay, very good. I think we're just about done here. And actually, that was my last question. Do you have any questions for me right now about, everything that we've gone through so far?
No.
No? Okay. All right, well, that concludes the health history, and sorry I had to ask you so many questions, but we're all done now.
Okay. Thank you.
Thank you.